Hello and welcome. I'm Whitney Roseborough. I'm the marketing manager here at Squire. Thanks for joining us today for our Medicare 101 webinar. Before we get started, I'd like to point out the Q&A section in the top right corner of your screen. Throughout the presentation, feel free to post any questions that you may have, and the presenters will get to those throughout and, of course, at the end. I've also shared a link in the Q&A box if you would like to sign up for our Squire Wealth Advisors e-newsletter. Now let me introduce you to our presenters today. Today you'll be hearing from Nathan Larsen. Nathan is a CPA and wealth advisor for Squire Wealth Advisors. And Craig Valgardson. Craig is an independent insurance agent in Utah, specializing in Medicare. He helps hundreds of people find the coverage that works best for them and represent companies with many plan options to find the products that will best work for you. So with that, take it away, Craig.
All right, thank you. Yes, born and raised in Utah. A little bit about me, I have 3 kids, 2 boys and a girl. Ages for the boys are 6 and 3, and then the girl's birthday is actually tomorrow. She'll be turning 1. I am affiliated with Helping Americans on Medicare and Medicare Enroll. I'm not endorsed or paid by Medicare or any government agencies. And this is just going to be a brief, or not brief, but just overview on how Medicare works, the different options that you have, no plan specific information, just general information on how Medicare works for you. So here are the 5 top questions that I get asked. So does having an agent cost more or cost money? The answer is no. So whether you go online, over the phone, or use an agent, the price is the exact same. Prices are set by Centers of Medicare and Medicaid. We do not control the prices. So again, whether you go online, over the phone, or use an agent, it's the exact same price. So what an agent can do for you is, if you're coming off group insurance, there's additional forms that you have to submit to Social Security depending on your age. A lot of people are working past 65, so you need to submit additional documentation to Social Security so you get away from the tax penalties. I was talking with a guy yesterday, getting ready to go on Medicare, and he's done some research on it, so he's called a few of the companies, and when you call the 1-800 numbers for the different companies, you get directed to 1 or 2 sides, either the Medicare Advantage side or the Medicare Supplement side. So I'm appointed with both, so it does not matter to me which side you choose. I just go over the pros and cons. So he told me a situation. He had some surgeries coming up. We went through his prescription drugs, and I said, here's how the Medicare Advantage works in your situation. Here's how the Medicare Supplement works in your situation. And then, so it didn't matter to me what he chose. And then at the end of the conversation, he's like, you're the first person that I've talked to that just told me the pros and cons for each situation and didn't try to push me to one or the other. The reason being is when you call telesales office's job is to enroll you in either the Medicare Advantage or the Medicare Supplement, whatever number you chose. So again, does not matter to me. I'm just here to help you navigate through the process and then go over your options for you. Next question, is Medicare one size fits all? Absolutely not. So just like that last situation, I went over the pros and cons for each, and then ultimately it was his decision. And then we'll just go over how Medicare works and then differences as well. Do you have to sign up for Medicare at age 65? So the better question is, what happens if you do not sign up for Medicare at age 65? You have 2 tax penalties, for B as in boy, and then also D as in dog, if you either turn 65 or eligible. Like my sister, she's on Medicare. Obviously, she's not 65 yet, but when she was eligible for Medicare, if she didn't sign up, she could have received those tax penalties. There's only one way that you get around this, is if you have a qualified employer plan through your work, then it does waive those penalties, but there is additional documentation as well that we have to submit to get around it. And then, does when I take my Social Security affect how much I pay for my Medicare? So Social Security alone will not affect your Medicare, and we're going to go over the IRMA tax and how that works, but that's where Squire comes into play, because other income does. So Social Security alone, no, but other income, what tax bracket you're in, that can affect your Part B and Part D premium as well too. And then how far in advance should you talk to a Medicare expert before signing up? 3 months in advance. Social Security is extremely backed up right now with how many people are getting ready to go on Medicare. And I'm working with a guy right now. It's been 6 weeks so far, and we're still in step 2 out of 3 for the process. And we're just following up to make sure they have all their documentation and information to get them going on it. Okay, let's get into how Medicare works. So Medicare has 4 parts. It has your Part A, your Part B, your Part C, and your Part D. So Part A is your inpatient hospitalization, your home health care, and hospice, skilled nursing, and then it does not include custodial care or long-term care. So what that means is this can come from an accident, an injury, a sickness, an illness, voluntary surgery. Say you only get 80% better and you're not showing progression. If you're not showing progression, then it becomes self-pay. Medicare stops paying until you got bad enough to go onto hospice, then Medicare would kick in and then start paying again. Typical premium for Part A is 0 as long as you've worked your 40 credit hours. And Part B is your outpatient services. So that's your office visits, your ER urgent care, your radiology, labs, surgeons, ambulance. Typical premium for Part B is $170.10, but Part B does have the IRMA tax. And this next slide shows how the IRMA tax works. So these are the numbers for 2022. So depending on how your taxable income, filing tax individual, 91,000 or less, or filing jointly, 182,000 or less, then you would be paying $170.10. And then it goes up from there, it goes all the way up to 500,000 or above individual, or 750,000 and above for joint. But what a lot of people don't know is that you can, so say you got set in the higher tax bracket because your last 2 years of work, maybe you sold a property, maybe you like you did a IRA withdrawal or a pension, and then you were in one of the higher brackets for your Part B. You can't actually appeal that IRMA tax and drop you down. You go in, so it was a one-time thing, or your income was this, and now your income's changed. You can appeal that with Social Security, drop down in the levels as well.
Yeah, there's a 2-year delay as well. If you notice, they're basing your 2022 premiums off of your 2020 tax return. And so just like Craig said, going into retirement, most people's income's higher than it's going to be when they do retire. And so that appeal process can be very valuable because otherwise you're stuck paying the higher premium rate for 2 years basically until your tax return shows a lower income, and that 2-year wait period is kind of over. And it's not a wait period, it's just that's the information Medicare has at the time when they set the premiums, and so it's a delay more than a wait. But yeah, cool.
Then your Part C or Medicare Advantage. So what this does, it combines everything into one card. So it combines your Part A, your Part D, and your Part B as well too. So these vary county by county, state by state. And then they're offered by private insurance companies. So how that works is Medicare is paid, your Part B premium is paid to the private insurance company to administer Medicare. And then they administer original Medicare, and they have to provide the same or better benefit than original Medicare. And then what plans we have along the Wasatch Front are completely different for the plans that we have like down in St. George area. So Medicare Advantage combines everything into the one card, and they're county by county, state by state.
Hey, Craig, real quick, just so we talked a little bit about hospital insurance and then Part B. Isn't Part B typically cover about 80% of costs for the costs that fit in within Part B?
Yeah. So the general rule of thumb, Medicare the Part B covers 80%. So it's an 80-20. And then what the Medicare Advantage plan does is it takes that 80-20 and then it breaks it down into co-pays for you and then gives you a worst case scenario. So Part B with original Medicare is an 80-20 with no ceiling, and the Medicare Advantage plan protects you against that.
So it's designed to kind of fill in that 20% gap that Medicare Part B doesn't cover.
Yep. Yeah. So it doesn't. Yeah. Designed to take everything to a copay and then give you a ceiling on it.
Okay.
Then Part D. So if you just have a standalone prescription drug plan, that's where your Part D comes to effect. There are other programs with Part D as well too, based on income, where you can qualify for extra help. I work with people that are dual, which is Medicare and Medicaid as well. So if they're on Medicare and Medicaid, they qualify for different programs as well too. So a bunch of different programs with Part D, and then we can go to see if you qualify for any of those additional programs as well. Part D also has the IRMA tax. So we'll get hit in two places, Part B that we went over first, and then Part D as well too. The income limits are the same. So if you fall under to the 91,000 or less, or individual, or 182,000 or less jointly, then it's just your plan premium. So depending on the plan you choose, the average is $30 to $40 for a prescription drug plan. That's what you pay for the prescription drug plan. And then if you're up in the higher, so the higher end of the tier, 500,000 or above individual, 750 or 750,000 or above joint, then the 7790 is in addition to your plan premium. So you have that on both Part B as in boy and D as in dog. And if you do not enroll in Part B and D when you're eligible, you do have a tax penalty on top of that as well too, just to be aware of. Prescription drug plan, the donut hole. People that have hit the donut hole understand how it works. Most people that have never hit the donut hole don't understand how it works. Basically, if you're taking tier 1 or 2 prescriptions, chances you're going to hit the donut hole are slim. If you have tier 3, 4, and 5 prescriptions, like some insulins, inhalers, things of that nature, there's a good chance that you're going to hit the donut hole. So how the donut hole works is, so you pay your deductible depending on whatever your prescription drug plan deductible is. After you have your deductible, then it goes to the copay. So your copay for the drug could be $40 or $50. The retail price for that drug could be $800 to $1,000 though. So it goes off the retail price of that drug. So you fill that drug 3, 4, or 5 times, you're going to hit the donut hole. Once you hit the donut hole of that $1,000 prescription retail, then you have to pay up to 25% of that. So when you were paying $50, $40 or $50 for that prescription before, now you're paying up to $250 for that prescription until your out-of-pocket costs reach $7,050, and then after you reach $7,050, it drops to what is called catastrophic coverage, and then it goes down to a small copay of like $3 or $4 or $8 to $10, just depending on the plan and how it's set up. Kind of a basic overview of how the donut hole works. If you've never hit it, most people still don't understand how it is because they've never experienced it. If you have experience of it, you know exactly how it works. On Medicare, you have 3 choices. You can stay on original Medicare, get a prescription drug plan. You can get on Medicare Advantage or Medicare Supplement. So let's just talk original Medicare. So you signed up for Medicare, you just have your red, white, and blue card. And you go to the hospital. So you go to the hospital, all the numbers in red is what you're responsible for. So go to the hospital, days 1 through 60, you're responsible for $1,556. So that resets every 60 days. You can pay this $1,556 up to 5 times in a calendar year. If you're in the hospital longer, days 61 to 90, you're responsible for $389 per day, up to $11,640. Days 91 through 150, you're responsible for $778 per day, up to $46,680. And then if you go to a skilled nursing facility, Medicare usually covers the first 20 days. And then you're responsible for $194.50 per day, up to $15,560. So that's just Part A. And then Part B, which we talked about a little earlier, is where the 80/20 comes into. So you have your Part B deductible of $233, and then it's 20% of approved amounts. So a $100,000 procedure, you'd be responsible for $20,000. $200,000 procedure, you'd be responsible for $40,000. There's no cap on original Medicare. Most people do not stay on original Medicare because there's no cap and it is extremely expensive if something catastrophic happens. Or you can get on a Medicare Advantage or a Medicare Supplement. So let's talk about the Medicare Advantage. So Medicare Advantage, they're county by county, state by state. So again, along the Wasatch Front has different plans than down in St. George area. So it combines everything into one card. So it combines your Part A, your Part B, and then it has your prescription drug plan as well. So Medicare Advantage, a lot of the companies have 0 premiums with the Medicare Advantage plans, and then they go up from there. And then on the Medicare Supplement side, so the main difference between the two is on the Medicare Supplement side, you're on the full Medicare network nationwide. So anybody that accepts Medicare nationwide accepts your plan. On the Medicare Supplement side, or Medigap, you have 3 cards. So you have your red, white, and blue card, and then you have your supplemental card that you'll show to the doctors and the hospital, and then you have your prescription drug plan as well too. So Medicare Advantage, county by county, state by state, and then Medicare Supplement, you're on the full nationwide Medicare network. Main differences there. Medicare Advantage. So like I mentioned before, the private insurance companies have to offer the same or more benefit than original Medicare. So a lot of the companies, depending on the program you choose, has dental, vision, hearing. Some of them include a fitness program where you get a basic gym membership. Most of them have your prescription drugs. Some people that don't need a prescription drug plan, say they're military retirees, they don't have to have 2 prescription drug plans. They have plans specifically designed for them. They fitness trackers, telehealth, and then over the counter. So over the counter is a lot of the companies give you a credit per quarter, and you can order things such as Band-Aids, first aid kits, pretty much anything over the counter that you can get. Some things to be aware of. A lot of the Medicare Advantage plans don't have deductibles. There are a few that have deductibles. You do have copays. So if you go to a primary care or specialist, you would have a copay to go see your doctor, similar to under 65 insurance or corporate insurance. Provider in network, depending on the program you get, whether it's an HMO or a PPO. So big difference between HMO or a PPO. HMO, you have to go to in-network providers. With a PPO, you can go in and out of network. Some just could have a higher cost if you go out of network. And then again, they have to give you more benefit than original Medicare, so you get the additional benefits with those as well too. And then Medicare Advantage plans does have a cap. So it takes that 80-20 with no cap, and it's going to give you a worst case scenario, depending on the carrier, of once you hit X amount of dollars, the plan's going to kick in and cover everything else. Some of them do have premiums, some do not have premiums. So they're just county by county, state by state, and a zip code on there. Medicare Advantage plans do have hospital copays. Skilled nursing facilities will have copays as well too. And then cancer, heart attack, and stroke, just to be aware of the maximum exposure. It's going to give you a ceiling if you had cancer, heart attack, and stroke for a worst case scenario that way. And now let's talk about the supplement plan. So if you're on a supplement plan and you were eligible for Medicare before January 1st, 2020, here are the supplements that you can still get. A lot of people think supplement F went away. It did not go away. You just have to have your eligibility date before January 1st, 2020, and you could still get a supplement F. I just helped a guy enroll on a supplement F about a month ago. He was eligible before January 1st, 2020, and he could get that program. So F and N were the most popular before January 1st, 2020. And how supplement F works is you pay your monthly premium, and then it covers everything else medically for you at 100%. So as long as it's medically necessary and Medicare approved, the plan kicks in and covers everything else at 100%. And then Plan N has a few copays. It does have the Part B deductible. This year, that Part B deductible is $233, and then excess charges. So how excess charges work is Medicare approves a certain amount. Say that doctor charges over that amount. It does happen in Park City area. Doctors can charge over the amount. They don't have to accept that amount. You would be responsible for that excess charge, is how the easiest way to describe that. After January 1st, 2020, here are the supplements that are now available. So G and N are still the 2 most popular. Supplement G, for instance, the only difference between the F and the G is the Part B deductible. So once you pay that Part B deductible of $233, then the plan does kick in and cover everything else medically for you. So you do have a deductible on your supplement side or your Medigap policy, but then also realize you have a prescription drug program that goes along with the Medicare supplement that has a deductible as well too. So one is for medical, one is for prescription drugs. So here are the election periods. So AEP, which most everybody's aware of, that they get bombarded with mail and TV advertisements.
Dinner offers.
Dinner offers. And that goes from October 15th to December 7th.
And that's kind of similar to like an open enrollment, right?
Yep.
When you were working?
Uh-huh.
Okay.
Yeah. So AEP, between December 15th or October 15th, December 7th, you can change your plan 3, 4, or 5 times, and the last plan you choose is the one that sticks and what's going to actually go into effect the following year. And so you may get that phone call and they entice you with a benefit for one program with one company. So you're like, yeah, let's do it. Then you talk to somebody else and they're like, well, this is how it works over here, but this is what we can offer. And then you choose with another company. Yes, you could switch to that other company. And then January 1st, whatever the last application's in is what you will start with January 1. And then they also have OEP, so open election period. It's actually going on right now. And that's through January 1st to March 31st. So during OEP, you can make a one-time change. So say you decided to change your program, you tried it out for January and February, and you just don't like it or you hate it for whatever reason. You can change back to the other Medicare Advantage program that you were on before one time. You can't do that more than once during open enrollment. Annual enrollment, you can do as many times as you want. Open enrollment, you have you can do it one time. And it's special election periods. So people that are working past 65 or past their eligibility date when they're getting ready to go on Medicare, obviously we have to submit additional forms to get away from the Part B and D penalty. But that's a special enrollment period. So you can still get on Medicare without having to wait to the annual enrollment period as soon as you lose your qualified employer coverage. And then IEP, so this is just your initial enrollment period. So when you're turning 65 or you're very first eligible for Medicare, 3 months before, and then 3 months after from your Part B effective date.
And a lot of times I'll talk to clients and they think that their Medicare is stuck and it's not. And so this is helpful to kind of understand that you can change your plan along the way as your life changes, which is important.
Yeah, for sure. Yeah, and then I just met with an existing client last week, and he had his health changed. So his health changed. He's taking some more prescriptions. And he called me up and he says, hey, this is what I have coming up. Is there anything that we can do? So he told me what was going on. He told me what his new prescriptions are. I ran the scenario and we found that a different program is going to save him money with what he has coming up because his health changed and he's taking different prescriptions now. And then drug formularies from company to company are different. So it's always good to run the prescription because obviously the whole goal is to save you as much money as possible on your prescriptions because that is the biggest heartburn is prescription drug costs. Hospital indemnity plans. So these, if you want information, you can let me know. So these are similar to like an AFLAC policy. So hospital indemnity plan, if you go into the hospital and you have a Medicare Advantage plan, obviously you're going to have copays. This pays similar to like an AFLAC policy. Most people are familiar with AFLAC. So if you're in the hospital for X amount of days, it'll pay you so much per day depending on your plan. They're fairly inexpensive. Some people like them, other people don't. But if you would like more information, be happy to get that for you. And then cancer coverage as well. So 1 in 2 men get cancer, and then 1 in 3 women may develop cancer in their lifetime. So cancer policies are just one lump sum, and they can help towards medical costs, obviously improvements to the home, transportation, lodging, living expenses, loss of income. If you people like cancer plans if it's high in their family. So we have options there if you're interested. All right, so here is your test. Does having an agent cost more? Absolutely not. Having an agent does not cost more money. Is Medicare one size fits all? No, Medicare is not one size fits all. Say we have you're getting ready to go on Medicare and you're obviously going to talk to some family or friends. So you go talk to a cousin or a brother or a neighbor and they say, oh, you need to go with Humana for whatever reason. They tell you the reasons why you need to go with Humana. And then you talk to your brother's like, no, you need to go with United Healthcare. Talk to another relative, they say, oh, you need to go with Select Health. Who's right? Technically, all those people could be right. I mean, for his scenario or their scenario, that's the company they chose because that fit their needs, but it doesn't mean that's necessarily right for you. So Medicare plans is not one size fits all and should be reviewed, especially if prescriptions or your health changes. And then do you have to sign up for Medicare at age 65 or when you're eligible? The answer is yes, unless you have a qualified employer plan through your company to where when you get ready to go on Medicare, or you make that switch, we can submit the additional documentation. And then does when I take my Social Security affect how much I pay for my Medicare? No, Social Security alone will not, but other income will, and that's exactly where Squire comes in to help you navigate through that process as well too. And then how far in advance? You do want to start that process 3 months in advance because it has taken 6, 8, 12 weeks just to get things processed with Social Security with how backed up they are for sure.
Hey, Craig, back on number 3, you know, retirement is a really big life transition for people, and a lot of times people, you know, retire before 65, but there's lots of people that also continue working. So what's your recommendation, you know, 3 months before they're turning 65, somebody's planning to continue working? Would they'd probably want to talk to you or another Medicare agent and their HR department and kind of work this out to make sure that they don't miss their application period, right?
Yeah, for sure. And so I meet with people that are on work or employer coverage, and we just run a review. We go through the Medicare, we go through how Medicare, the cost for Medicare, and then what they're paying right now. So I met with a guy last year. He was getting ready to retire end of last year and just ran the scenario. If he goes on Medicare, what are his health costs going to be? If he stays on his employer plan, what are his health costs going to be? And I was able to save him $300 a month on Medicare and get him the same or better coverage, just depending on the situation in your plan, than just staying on his work plan. So he got on Medicare, he saved $300 a month, and his coverage was essentially the same to what he was getting for work, just saved him money per month. Definitely.
Okay. If it turns out the other way where the work coverage is better, maybe the employer's covering the bulk of the cost or something, what do they have to submit at age 65 if they're, say, planning on working 2 more years until 67?
So they don't have to do anything at age 65. They just need to keep on checking with their HR. So the plans change every year. And yes, your plan could be a qualified plan this year. So I'm working with a lady right now. Her plan is qualified this year. And then we're just going to talk every her company's open enrollment, and just to make sure the plan stays qualified with B and D. If at any time, because she's going to be working a couple more years, if at any time it becomes a non-qualified plan, you're going to want to make that transition, or else you will get the tax penalty. Yeah. So even though it's qualified this year, your plan could change next year, and say you chose a different option. A lot of companies offer different options in the plan. Some of the options could be Medicare qualified. One of the options could not be. So you want to look at that and even review it every year if you're past your eligibility date as well.
And so we talked a little bit about the premium prices based on your income. Talk to us a little bit about that tax penalty if somebody blows it and forgets to enroll in Medicare. Right. There's a penalty that they pay kind of the rest of their life, right?
Correct. Yep. They don't have anything set in stone. Like if you go to Medicare.gov's website and you look it up, there's not an actual set in stone percentage. It can range from 15 to 20%. It says it does not go over, I'm pretty sure it's 20, it might be 25%. Each month you don't have it. So say you did not enroll in Medicare eligibility at 65, you did not have a qualified plan. 2 years later, you enroll in Medicare, they're going to take that monthly premium at that percentage. It can be up to 20, 25%. I'd have to double check it for sure. And then that gets tacked on to your Part B. And then your Part D has a penalty. That one's around 1% of the average drug plan. So they do have, if you combined everything into a Medicare Advantage, they do have prescription drug plans that are included, obviously, and it's a zero premium. So it doesn't necessarily have a premium, but you would still have that penalty. Right. So just something to be aware of. They don't have an exact number set, and when they run their scenario, it does go off how many months it has not been in effect.
Yeah, so definitely don't want to miss that.
Right.
The sign up.
Right. There's no appeal on that one. This is what it is.
Okay. And that's where an agent really is handy, because it doesn't cost you anything extra. You know, think of them as a guide, guiding you through this very complex process. You know, you might be able to do it alone without an agent, but why would you not hire an agent when there's really no downside to hiring one?
Right. Absolutely. Yeah. Instead of having to stay on a 1-800 number. I mean, I get phone calls constantly. They're just asking me questions. Hey, I'm switching a doctor. Can you help me find a doctor? I can search that extremely fast. I log into the website, I put in the zip code, and then we can search doctors and facilities a lot faster than staying on hold for 40 minutes or an hour on the 1-800 number calling that. So yeah, definitely. Thank you guys for joining, and I think we'll have questions now, right?
Yeah,
You guys have any questions?
If you have questions, type them in the Q&A. We'll try and get Craig to answer those. I've used Craig several times with my clients, and I've get really good reviews. They all love him, and he really helps drill down to what's specifically best for you. And so I would definitely endorse Craig, or there's other agents out there as well that you could get in touch with. But it does make sense to use an agent, and this is an area that's very, very important. It's definitely high on the top 10 concerns for someone transitioning into retirement. So,
and always changing.
Yeah, complex and always changing. Yes. So, yep. Thanks for attending today.
Yeah,
and again, if you have a question, don't be shy. Type that in there. Chances are someone else has a similar question, and we'll do our best to answer those and get you on your way so you can enjoy the rest of your day.